Hi everybody, my name is Baba Tarawali, born and raised in Sierra Leone in West Africa. Work and live in the Netherlands. I'm an author, a journalist, and a public speaker. I also see myself as an independent press activist. Together with my colleague Kyle, we will be moderating this first session of the World Press Freedom Conference.
Hello everyone around the world. My name is Gaëlle Vejal. I was born in Cameroon and raised in France, and I'm currently living in Amsterdam, the Netherlands, where I work as project officer for Free Press Unlimited. And I'm very pleased to be with you today on this special occasion.
Thank you, Gaëlle. Welcome to the first session of the World Press Freedom Conference. We are proud to be taking part in this program from Studio Desmet in Amsterdam. You can listen to this conference in French or English. I believe you have the translation option at the bottom of your screen.
I'm sure you will all agree with me that this year has been crazy challenging. We've all faced the lockdown measures, the hand washing, adjusting to new way of working, let alone all the people who've lost their job, all the people who've lost loved ones. It's been upside down all over the place. And it has also affected journalists and media organizations all around the world who have faced challenges to continue to report on the Covid-19 pandemic. And many countries have been affected by these same challenges, including countries that usually rank high on the press freedom index, just like the Netherlands.
Last year, at the beginning of March, at the peak of the first outbreak of COVID-19, the European Commission sat together with several organizations to see how they could support media so that reliable information on COVID-19 could be guaranteed in various parts of the world. In a very short notice, several projects supported by the European Union kicked off. One implemented by UNESCO called #CoronavirusFact, addressing the disinfodemic on COVID-19 in conflict-prone environment. It's focusing on 4 regions and 9 countries. We are going to see some concrete activities in Latin America, Haiti, and Iraq of these projects that have a large focus on fact-checking.
Another project developed with the support of the European Union is called COVID-19 Response in Africa, Together for Reliable Information. So this project is now implemented by a consortium of 6 international organizations, which are International Media Support, Fondation Hirondelle, Deutsche Welle Academy, Article 19, Reporters Without Borders, and Free Press Unlimited. So the goal of this project is to support media organizations in sub-Saharan Africa so they can continue to do their work in reporting to the public on the COVID-19 pandemic. So far, more than 60 organizations in Africa are directly involved in this project.
Other projects have been implemented by Internews, and later on in this session, we'll also share the experiences of the emergency funds for media in Latin America. In this 1-hour session, we'll highlight some of the successful emergency measures taken in the framework of this project. We'll put the spot on some concrete activities that has been implemented by these organizations and try to see what worked well and what did not work well. Maybe there are some lessons to be learned for possible future crisis response. We'll focus on concrete activities undertaken in Guinea-Conakry, Nigeria, Congo DRC, Latin America, the Caribbean, and Iraq.
But before we have a closer look to emergency measures implemented by some of the organizations involved in this project, let us give a virtual floor to Jutta Urpilainen, who is the European Commissioner for International Partnerships.
In a couple of days, we will mark World Press Freedom Day. The European Commission is committed to protect journalists and support independent media. Especially right now, when we battle both pandemic and infodemic. We need to fight disinformation together. As journalists, bloggers, and activists, we count on you on the facts and on quality of independent reporting. You can only pursue your work freely when you do not have to fear. We stand with you. The European Commission has supported independent journalists with 20 million euros during the COVID crisis. Many of these projects support journalists who reach the most isolated communities and tackle disinformation related to COVID-19. You will hear in the conference about 2 of our projects. The Commission also honors courage in journalism through the annual Lorenzo Natali Media Prize. It rewards the excellence of journalists reporting about fundamental issues like inequality, poverty eradication, and sustainable development. Dear friends, democracy and the rule of law rely on freedom of expression. On the 30th anniversary of the Windhoek Declaration, we must do what is needed. We must stand up for the journalists detained, beaten, cyberbullied, or killed for reporting on the pandemic. We must address women journalists' specific challenges, because the stakes could not be any higher. Independent quality journalism and freedom of press are the cornerstones of democratic societies.
Thanks so much, Ms. Upulenen, for those strong words to support fellow journalists, our colleagues. On behalf of all partners involved in this project, a great thank you to the European Commission for the very swift response to the COVID-19 pandemic by supporting media in several parts of the world so that they could continue to inform their audiences.
Let us now dive to the concrete activities implemented in response of the COVID-19 crisis all around the world. Our first stop is in Guinea-Conakry in West Africa, a country which was heavily affected by Ebola some years ago.
What we saw during the Ebola crisis, and which is now reinforced by the COVID pandemic, is that the collaboration between health workers and journalists is crucial. So many rumors are spreading around it at high speed through social media. And in the beginning of this crisis, a lot of people were not convinced that COVID is real, danger, and the virus exists. A lot of projects have been undertaken where doctors and nurses have been invited at radio stations to inform the audiences. In other cases, journalists and animators of community radios have been trained by people of WHO and ministries of health of those countries.
So before we speak to Aïssatou Barry, who is a member of Association of Scientific Journalists in Guinea, let's watch this very short clip. Bonjour Aïssatou Barry.
Bonjour Gaëlle.
So, hello Aïssatou Barry, how are you? I am very well, how are you? Thank you so much for being with us today. So, you are a member of the Association of Scientific Journalists in Guinea, who is, together with the Fondation Hirondelle, COVID-19 response in Africa, together for reliable information. So tell us, how does this collaboration happen? How does it take place? So for us, in the Association of Scientific Journalists, and I think it's the same for all journalists across the world. When you want to participate in this fight for the right information, you need to go towards the right people. For us, these are healthcare professionals because they know the secondary effects, they know what's going on, they can really be the ones who implement. Of course, we also work with religious leaders, but we understood this right from the start. And this is why our magazine, in our magazine, there's also one part that's dedicated exclusively to healthcare professionals, because for us, they are the ones who can speak the best about the pandemic. So we have each week someone invited, a professional, who will speak to us, and we will carry an interview on current subjects, on what worries the population. In our association, we say to everybody that we are not scientists, we are journalists, but we work on health issues, and it's important for us to give the floor to these healthcare professionals. So collaboration works very well because we are well known. Even before the COVID project, the association was well known by healthcare professionals because we work on various questions on health, and it's therefore quite easy since the start of the pandemic to have access to this information. In some ways, it's also difficult sometimes because we do not diffuse straight away. We have a partnership with local radio. Our audience is mostly... The interpreter apologizes, there's been a cut.
La pandémie du Covid-19, les activités qui sont mises en place on pourra en tirer quelque chose de ça pour, on ne l'espère pas, mais s'il y a une...
So there has been many things implemented, and we think that maybe in the future we can implement these knowledges. Thank you so much for this information on Conakry. We share a lot. We share culture, we share tradition, and we say often that when one of these African countries comes...
What our partners did in Nigeria, the giant of Africa. Well, in many, many aspects. Do you agree with me, Gail?
Well, I agree with the fact that they are giant, but I really like the quote about the flu, because I feel like this is very much what the COVID-19 pandemic has highlighted, that we are all interdependent, all of us. So I really like this quote.
Okay, nice. That's why we are sitting 1 and 2 meters apart. Eh? We are interconnected. Yeah. When starting the program, countries like Nigeria, we are forecasted as most at risk. Cities like Lagos, with more than 14 million people. Imagine that, 14 million people. People packed in minibuses trying to find their way and trying to live with a minimum of dignity. How to deal with these measures, such as social distancing in a country with such high density of population. How to implement the recommended measures without the right facilities in place. How to deal with those who don't believe in this virus at all.
So in Nigeria, Free Press Unlimited worked together with a partner called Page Initiative. Their focus area is the northern part of Nigeria, where there is a lot of internal displaced person who are, some of them are, for example, affected by the Boko Haram terrorist group. So let's have a look at what Page Initiative have put in place in that region.
Since the first case of COVID-19 was recorded in Nigeria in late February 2020, life has not been the same. People are encouraged to take preventive measures to protect themselves from the virus. Social and physical distancing, constant hand wash, use of face masks are encouraged. This seems simple, but lack of adequate facilities like running water or space in urban poor community makes it almost impossible. The attitude of Nigerians to the virus doesn't help matters as well.
I don't believe it's a corona day.
I've not seen anybody with it, none of my relatives or someone I know or any of my friends, nobody that I have seen that have it. So I don't believe in it. They are just saying it, so I have not seen with my own eyes.
Yeah, I believe there is COVID-19.
COVID-19, when I believe it's real, but some people don't believe it's real. Because in this area, the COVID-19 don't affect anybody here. That is why they do not believe it.
Actually, I believe in COVID-19. But I didn't see it as something that will kill me. In my faith, I believe that I only take the precaution of COVID-19. But I never believe that COVID-19 will kill me. But I believe that it exists.
Most people do not trust information from relevant authorities where the pandemic is concerned. A lot of people are still distrustful of the vaccine.
I will not take COVID-19 vaccine because I believe myself, I don't have it. That is why I cannot take it. Me, sometimes I used to take agbo. So all those things, native medicine, all this English medicine, sometimes I don't like it to take it like that.
Yes, I will take COVID-19 vaccine, yeah. And they say prevention is better than cure. You understand me? Mm-hmm.
No, I won't take it. Since I don't have it, I don't see any reason why, or I have not seen it. I'm just hearing of it. So I have not seen it. I have not witnessed, nothing. Even I myself, I don't even believe in the COVID-19. So why would I take the prevention? It's of no use to me.
The reason why I will not take it is my religion belief. I believe that even with the corona itself, it is being ordained by God Almighty that we experience such at a particular time. And if it will come to be that someone will die, in regards to that, you will still die.
I will not take COVID-19 vaccine because I did not know anything about it. I don't know how it works, so I can't take COVID-19 vaccine.
It is the responsibility of the media to educate and enlighten people about the dangers of COVID-19. To this end, Page Initiative, as part of the COVID-19 Media Response in Africa project, in collaboration with Free Press Unlimited and the EU, has been building the capacity of Nigerian journalists to report human interest reports on COVID-19. This is to help citizens and the government understand the gravity of the pandemic and to hear each other better.
We are now going to Umi Bukar. She's working for PAGED, Participatory Communication for Gender Development Initiative. Umi is a gender rights activist who specializes in media for development. She strongly believes in providing a platform for direct voices, especially for the underrepresented in the society. This she has done through several capacity building activities for journalists in Nigeria, as well as community interventions in rural and urban poor communities. Good day to you, Umi Bukar. Welcome to the show.
Thank you.
Yeah.
Good day.
I'm really wondering because we have seen lots of people who do not really believe that this virus exists, and some don't even want to take the vaccine. I'm really wondering, how are you going to convince this type of people that COVID is real, this virus is real, and how to convince them also to take this vaccine? What is your method? What are you doing to get that done?
That's a very tall order. We try our best.
I believe that a lot of times the disbelief is as a result of lack of information. So we try our best to give as much information out to the public as well, because a lot of people say they don't believe in COVID-19 because they've not seen anybody that has had it, and so we try to give them information about COVID-19 through participatory media, so that we bring the reality of the virus, much closer to them by giving them examples of people who have had it, people who have died because of it. There have been so many undiagnosed deaths in Nigeria since COVID-19 started. For journalists themselves, a lot of them also do not believe in COVID-19, so we do a lot of creation awareness for them on COVID-19, and then we guide them to see other aspects of COVID-19, because for a lot of the people, while they don't believe in COVID-19 as a health problem, they've also had so many other aspects of the virus that has affected their lives. So, for instance, financially, people have lost businesses, people have been separated from loved ones, and so many of those things. So the more you focus on those things that actually affect them personally, while giving them the possibility that when something like this happens, they might not be able to help themselves. And I mean, the healthcare situation in Nigeria is really, really, really horrible. Very bad. And so if the media, for instance, writes reports on people who are not able to access healthcare when they need it, and then by the time the pandemic joins, when somebody gets COVID-19, where do you go to? So it's better for you to prevent, even if you don't believe in it. Don't wait until you get it before you believe in it, because there's very little opportunity for treatment if you don't have primary health centers in your communities and your general hospitals are not functioning properly. So the best way is to prevention, even if you don't believe in it, because you don't have access to quality health care. So it's just good sense to protect yourself either way.
Okay, very true. I really understand what you are trying to say. But one question I have for you is you are giving training to other journalists on how to tackle this. What do you do, and how is the training? What does it look like? The training you offer? I mean,
for us, the training, it's important to convince the journalists themselves, because, the last workshop I had, a journalist told me that, the whole COVID-19 is a Western propaganda. So, how do you let out people like that who themselves are struggling to accept the reality of COVID-19 to be the ones to inform people? So for us as an organization, we try to, bring the truth closer to the journalists, convince the journalists first before we even give them, support. Because again, Nigerian media doesn't have a lot of support when it comes to covering reports, especially now in the pandemic. They don't have, PPE support. They don't have transport support. Now that, prior to this, you probably use public transport to go and interview, subjects for your report. But right now, you have to maybe take a private car, and you don't have that kind of resources. So we try to help with those kinds of resources. And then we also try to show them ways that they can, use human interest to convince the population. So we have them pitch their stories, and then we guide them through it. So if somebody wants to write a report on this, and knowing how stubborn people are on accepting COVID-19, but they accept COVID-19 reports if they can see the human implications of that. So we guide the journalists to frame their report in such a way that it will speak to the people, and then it will convince the people.
Can you just tell me how you do that in this case?
We try to build the confidence of female journalists to also apply for things, to put themselves out there. We have a workshop for journalists, I said, scheduled to hold in the Northeast. But when we contacted all of our journalists that were supposed to be part of the workshop, almost all the female journalists told us that they would get back to us whether they would be able to attend or not. And when we thought about it, we realized that it was probably because, they were not comfortable with the security situations and everything. So we found a way around it by, separating the location into two different locations so that it's closer to the female journalists and they have easier access. The women, they have different considerations that they have to put into place. Husbands, they have to take permissions from husbands or for their fathers, or they have to think about their children. Especially in northern Nigeria, a lot of the women are reluctant to participate in activities that are kind of physical because, they don't like to be close to men or things like that. So we make it very, we are very gender conscious when we are training, even when we are selecting our tools for workshops so that the women can be more comfortable, coming back to us over and over again.
I want to thank you very, very much and have a nice day and continue the good work in Nigeria.
Okay, so now we are heading to the DRC, another giant of Africa. So in the Democratic Republic of Congo, one of the organizations which is also active in the mitigation of the pandemic is the Association of Female Journalists, which is called AFEM. They operate in the city of Bukavu, which is located in the eastern part of the Congo.
Wasikilizaji wapenzi, ya mchambo na karibu kuitegea sikio kipindi pamoja tupiganishe corona.
Quand les informations ont circulé sur la pandémie.
So when the information arrived about the pandemic, it was a panic in our community. People thought it was the end of the world. There was a real fear. Here in Bukavu, in DRC, we felt that the pandemic was misunderstood by the community. Many people thought it was a disease of white people, that it was a disease that affected only rich people who traveled, and the same community was really ignoring the issue. AFEM works with rural radios in 5 territories with the goal to make sure that the right information gets to our to the community. We raise awareness with healthcare professionals. We also have radio spots for raising awareness. We have caravans to diffuse our message, to show the population that this is a reality and that all should protect themselves and protect the others.
On a pensé que intégrer la comédie.
We thought that integrating comedy would be something positive because via comedy you can get a message across. People laugh, people relax. However, the message gets across, and we also raise awareness about masks. We put together people. It's not easy to have them their attention for a long time if the activity doesn't interest them. We need to really get their attention about this issue. We help young journalists in territories so that they have access to information and so that they can publish on a social network this information about the reality of COVID. Before this training, as a young journalist, it was difficult to answer some questions about COVID-19. Currently, we can easily answer these questions during our missions. We also do comedy, small drama to get our message across. The challenges were that there are communities that believe a lot into rumors. So it's not because we say that corona is there and that it's a danger that people will believe us. So the aim really here is to touch young people, women, and marginalized populations. It takes a lot of time to show them that corona is here and that everybody needs to be involved to protect each other against COVID. For us, there was also self-medication with the community. But as a media, it was our responsibility to raise awareness more with the authorities, with health experts and vulnerable groups, to show that when you're sick, you need to go to the hospital, because we noticed that people were using natural remedies. And we really tried to get rid of these practices and show that it's important to go to healthcare professionals in hospitals when you're ill.
Merci beaucoup. Bonjour, Julienne.
Thank you so much. Hello, Julienne Baseke. I hope my pronunciation is correct. Yes, completely correct. Hello, Gail. So you are the coordinator of AFEM, so this Association of Women in the North Kivu, and the responsibility of AFEM mainly focuses on women. And I'd like to ask you how you thought that the pandemic affects more women than men. Thank you, Gaël. I'm going to start by rectifying slightly. So AFEM is an association of women in media, which is based in the south of Kivu in DRC. We have activities also in the north, but the headquarters are in the south. But now to answer your question, the pandemic affected women and men differently. And if we're going to talk about gender, then also boys and girls, because as you know, there's cultural norms that give us some roles. Women have housework. They are victim of many stereotypes. In particular for gender, there's everything that regards housework, cleaning, cooking, etc. And all this is women's responsibility. Women have no time to sit down, to follow trainings, because they work in the field. They have to make an income as well. They have to make sure that their family survives. With the many wars, I also have to say that many sectors are paralyzed. Men are out of work, and it's women who take the responsibility and make sure that their family survives. So we now have a mobile radio. This mobile radio makes sure that we meet women in their neighborhoods, in their circles, in their activities. And this is when we showed in this video as well that we have reporters that go and meet women in their homes, even where they work, where they carry out their activities. And the whole radio goes there with the technician, with the moderator, with the journalist, to inform women, to make sure that they have access to information and collect their feedback about information that's given. So AFEM works with young people as well, reinforces their capacity to give them the possibility to give the right information, to use their energy. This is how the young people also work with AFEM, with these young people and women and vulnerable groups. They are at the heart of the production of information. The young people make the reportings, the interviews. There are women, but also young people who carry out discussions and dialogues with groups of women. So the AFEM uses this to make sure that young people, women and vulnerable groups have access to the right information and that they are at the heart of information. Thank you so much. We now just have to wish you a lot of success in the future of this project. Thank you so much for having been here with us. Thank you, Gail. It was an honor to be here and share our experience.
Now we are going to change continent from Africa to Latin America and the Caribbean. Kathleen Bird is a program officer working on Latin America and the Caribbean portfolio at Internews, where she leads the organization's current Rapid Response Fund initiative to support media and communicators impacted by the COVID-19 pandemic in the region. The project is funded by EIDHR and will provide emergency assistance to media who are serving vulnerable people especially women who are at risk in communities and who are struggling to survive against the backdrop of the COVID-19 crisis. These funds will ensure that the most vulnerable communities across Latin American countries have sustained access to trustworthy information on the pandemic. But let's have a look at the presentation of Internews first.
In 2020, Internews launched a rapid response fund, Information Saves Lives, to support media and communicators across the world to guarantee audiences sustained access to trustworthy, needs-driven information on the COVID-19 pandemic as it unfolded. We received 81 applications from Latin America and the Caribbean, out of which we selected 29 to receive financial support from 10 different countries in the region. With an average grant size of around $3,000, the focus was very much on local groups informing at-risk communities, and many of them did not have previous experience reporting on health. This year, we are maintaining this effort to respond to the high demand for support from media and communicators in the region, which is one of the worst hit by the pandemic. And this is why we're launching a rapid response fund specifically focused on Latin America and the Caribbean. We have seen cuts in advertising revenues threatening the sustainability of media, increasing precarity of work, especially for independent or freelance journalists, and impacting on their ability to reach sources and to conduct their day-to-day activities. Those who do so are facing a very high level of personal risk, especially in absence of personal protective equipment or health insurance. And we are also seeing in certain places closing channels to access information on the pandemic. We launched an open call for participation offering 3 different types of funding of up to 15,000 euros to cover operational needs and content production. We made an effort to keep barriers of access low in order to reach small, hyper-local media who engage with their communities, with a special focus on the most underserved groups, which are indigenous people, Afro-descendants, migrants, rural populations, women, and people who identify as LGBTQ or other sexual and gender identities, and who need contextualized, targeted, and actionable information to protect themselves against the disease. We're currently processing 499 applications from media, individuals, and civil society organizations who do media-type work in the region, 33% of which work at the local or community level, and 20% of which work in minority languages other than Spanish, English, French, or Portuguese. From our experience in 2020, we learned that while our support is mainly financial, launching a rapid response fund also helps grantees strengthen their networks with similar organizations in the region, leverage new funding opportunities, improve morale in very trying times. And while at this stage, most media and communicators already have experience messaging on the pandemic, it also provided access to health journalism resources and information. And we're going beyond financial support by partnering with organizations in the region, Consejo de Redacción, Chicas Poderosas, and Fundamedios, to train participants in areas that range from gender inclusion to fact-checking to administration and finance in order to have a more lasting impact on media and communicators in the region. Thank you very much.
Thanks, Kathleen, for this presentation. I think that the strong networking aspect of this project is very interesting, creating connection between similar projects, a similar organization on the region. It's always a very valuable point. So thank you, Internews, for your work on that on this topic, on that matter.
The following videos comes from Haiti. It's the first video of the UNESCO program, #CoronavirusFacts, addressing the disinfodemic on COVID-19 in conflict-prone environment. In the project in Haiti, they focus a lot on capacity building of Haitian journalists, how to create maps, how to use word clouds, and so forth. The project has also an element of media literacy, so the people are better equipped to distinguish real news from fake news and rumors.
Donc, nous avons maps là. Est-ce que nous connaissons plus qu'au centre corona qui gagne dans Wanamen? VDH. Côté lié.
Frontière.
Oui, c'est Pierre. Agrandi toujours pour arriver Wanamen.
Non, oui, c'est bien. L'arrivée là, après.
Une description.
Description.
Exactement. Description. Bon, description, ça c'est travail journaliste nous. Est-ce que vous faites test? Eh bien, vous faites test, mettez-le. Est-ce que vous prenez patient? Mettez-le.
L'autre bagage que m'apprends pendant 2 jours de formation, ça, c'est comment pour nous réaliser des cartes avec information que nous avons diffusées. Comment nous sommes capables de représenter sous forme de cartes. Parce que je dis, vous avez plus de moyens pour capable de travailler. Par exemple, un téléphone qui est connecté sur Internet, c'est déjà un pile bagaille. Donc, mais il faut connaître. Et donc, un pile bagaille que nous ne connaissons pas.
Financé par l'Union européenne, qui est le coronavirus fact, pour mettre l'accent sur des faits. Comme journaliste, à partir des faits, de nouvelles qui sortent pour informer la population pour capable de sauver la vie.
Même si ce n'est pas une vidéo qui est longue, la montrer, ah, t'es là. Ça, c'est des gens de preuve qui montrent que regardez mal sous place.
Nous apprenons en pile et puis on montre qui gens pour nous faire suite sur une série de réseaux sociaux. Si nous commençons à faire un bagage, que nous avons besoin continuel, nous faire. Et qui gens pour nous faire des nuages de mots que si on va me connaître, même pas de connaître qui application pour nous utiliser, pour nous faire. Et je dis, je suis vraiment content de le faire, je suis vraiment apprendre de ça.
Observer aux minutes de recueillement et dans Lévi Joseph et victime d'assassinat dans la date 6 octobre 2019, c'est extrêmement important et pour nous observer aux minutes de recueillement.
C'est ça qui est. Malheureusement, des gens qui se les podcasts, ils ne vont pas comme ça qu'on fait les RSS.
Le journalisme est une formation continue et nous méritons un langage entre connaissances empiriques avec nouvelles technologies. Donc, commencer avec l'expérience que nous faisons ou bien avec 2 jours de formation que nous suivons là, ça va permettre que nous améliorer la qualité de service que nous avons avec la population dans le cadre de travail comme journalistes.
Formation ça, sur question de vérification des faits, journaliste des données, et sensible les journalistes qui doivent prendre le devant, comme c'est des journalistes professionnels par rapport à des informations. Nous organisons dans Mibalais, pour Liberté Wanamet, et dans le département Nord, c'est-à-dire Cap-Haïtien, mais également dans le Grandance, Jérémy, nous passons au CAI, nous passons dans NIP, Miragouane, et nous finissons également dans le département Sud-Est, Jacques-Mer.
On va et puis on va ajouter nos médias. Chaque côté nous aller, presque plus gros journalistes apparaissent et puis ils participent avec nous dans le débat. Ni jeunes, ni monde qui a plus d'expérience, mais quand même, il y a un bel mélange, un bel échange et puis nous vraiment connaissent l'autre, ils ont habitué à travailler ensemble, ils débattent ensemble et ça vraiment son dynamisme que nous ne pouvons pas attendre ça dans une petite ville, dans Wanamen ou bien Mirmalais.
Maintenant, le projet ça, on nous dit que il est financé par l'Union européenne dans le cadre d'un projet coronavirus FAT. Et justement pour lutter contre les informations. Donc il y a 2 aspects là-dedans. Il y a en amont, il y a formation journaliste, mais également en aval, il y a un public qui doit éduquer aux médias et à l'information. Donc c'est dans ce sens que nous allons faire une campagne justement d'éducation aux médias et à l'information pour nous être capables d'identifier nouvelles qui fiables à nouvelles qui pas.
So this was another valid valuable contribution in this fight against COVID-19?
Still in the same topic as disinformation, fighting disinformation, we are heading to Portal Check. It's a tool which was developed exactly because of this very reason, the spread of fake news, which we know has been very challenging, specifically during this pandemic. So Portal Check is an online initiative that offers resources and tools on how to combat misinformation or disinformation on the COVID-19 pandemic in Latin America and the Caribbean. So it's a joint project implemented by UNESCO in partnership of Chequeado, Latam Chequea, I hope my pronunciation is correct, an alliance of 35 fact-checking organizations. So let's watch the video.
Juan recibió en su celular una noticia de un supuesto médico diciendo que la sal combatía el coronavirus. Por el miedo y la incertidumbre la compartió en el grupo de la familia y en minutos la noticia ya había llegado a cientos de personas, miles de personas. La noticia se fue haciendo viral en todos los países de la región. Como esta, muchas noticias falsas se difunden todos los días. Por esto es tan importante que asumamos la responsabilidad de la información que compartimos. Para esto hemos creado Portal Check, una gran alianza de organizaciones de verificación de América Latina y el Caribe, en donde reunimos recursos, noticias y experiencias para cada tipo de público. Participa en nuestros eventos con investigadores e influenciadores para que todos aprendamos a combatir la desinformación sobre el COVID-19 en América Latina y el Caribe. Portal Check, promoviendo el pensamiento crítico.
We have two guests. Olivia is the Director of Impact and New Initiatives. Oil Coordinator, she's Chequeado, yeah.
Chequeado.
Chequeado.
We are in Argentina, and Ludwin is in Bogota, in Colombia.
Okay. And then we have the Ludwin, who is a digital strategist and director of Trigon. Am I right?
Yes, it's correct.
But I will start with Ludwin. Let me just ask why Portal Check is an important initiative, and how does it support the combating of disinformation in Latin America and the Caribbean?
Thank you. So with the pandemic, one of the most important things became the disinformation in our region. So we had to start by understanding the digital nature of the problem. So that's why we cannot fight disinformation only with traditional media. So this project had an important focus on obviously fact-checking organizations. That they are the main tool to fight disinformation, but it is not enough if citizens are not involved and active fighting disinformation. So that is why this project had an important focus on involving digital influencers, content creators, YouTubers, and all these digital figures to take advantage of their huge audiences, the engagement that they have with their audiences, to get across these messages. Because there's a lot of difficulties with communicating this. It's not only, it's a very complex theme. So one of the main strong things about the project was the centralization of efforts that was made by a lot of the work that Chequeado and Olivia and his team has done with Latam Chequea, that groups these organizations of fact-checking in Latin America and the Caribbean, and also the interest of joining and integrating these different stakeholders, organizations like UNESCO and the European Union, also with digital influencers and journalists and teachers and all these different stakeholders that make up this huge project.
I'm very curious about the traditional method you talk about. How do you learn people who are more traditional, perhaps not literate? How do you teach them about this fact check?
Yeah, that is why it's so important to take advantage of these influencers, because most of them are not necessarily professionals or like big, very big institutions or things like that. They are talking always to common people, to very young people, to kids. So that is why it's so important to make these relationships with the audiences. So that is why it is so important to involve this kind of people, the digital influencers and young people.
Okay, it is clear. I'll come back to you. Let me go to Olivia. Olivia, what has been the role of fact-checking organizations in the pandemic on your own side?
So, as we have seen in the pandemic, the amount of disinformation that has circulated, first about the virus itself and about its origins and how it spreads and the symptoms and false cures that were circulating. Now we're seeing a lot with the vaccines. So sadly, we've had an enormous amount of work as fact checkers to show that all this disinformation is circulating. And I think our most important role in this is not only debunking and showing that specific disinformation is false, but also showing why it is false and how we arrived to that conclusion, so that can give other people tools so that when they encounter a new disinformation, they have more information on how things work and what kind of steps they can take to verify a content so that they don't fall for another disinformation. So I think our role is essentially in showing what is false and in showing how to show that something is false so that someone else can do it by themselves when they encounter a new disinformation.
Yeah. Olivia, can you just share with us one disinformation which was debunked? Just a common one.
So right now we're debunking a lot of disinformation on vaccines and, for example, supposed adverse effects of vaccines. So we have, for example, the disinformation that some vaccines will make you infertile is one that we're seeing quite often and that we're debunking all the time, or that RM vaccines will change your DNA, and a lot of vaccines a lot of disinformation in this line of giving false secondary effects of vaccines.
Mm-hmm. Okay, let me come to Ludwig again. I'm very curious with the influencers, and how do you get them participate in this?
Yeah, there is a very complex thing by when you have to curate and to investigate people, because also there's a lot of accounts with fake accounts and things like that. So you have to be very careful. But when you start watching their contents, you can see a lot of people who are very talented online that have very huge millions of followers and things that they are not being used enough. The governments and a lot of institutions should be using should be using more of these influencers, because they are taking most of the attention of the people now, more even competing with traditional media. So that is why we have to start focusing on this independent people creating these contents.
Very interesting. You bring me now to Olivia because of this traditional media, so I want to see how Portal Check, the future of Portal Check, and how the traditional media will learn from that approach. Olivia.
Yes, so sadly, this information is here to stay, and we don't think we'll be seeing the end of it anytime soon. I think we're going to have to live with it. So we need more and more different tools and different ways to fight disinformation and to try to counter disinformation and stop disinformation. And so Portal Check, as Ludwig was telling, is a joint effort between different kinds of organizations, and that it addresses different publics. So we have specific resources for journalists, for influencers, for teachers, for citizens who want to be informed. So I think that this kind of approach in which we try to centralize and gather the efforts of different organizations, as we've done with Latam Chequea, which has these 35 organizations across the region, take all that content and then share it for different publics so that we can all work together. We need all the help we can to fight this information, and we need all actors involved. So the more we can work in a collaborative way, and the more we can work with traditional media, but also with teachers teaching their students about critical thinking, with influencers, with all kinds of actors that can come together to try and counter disinformation. So I think the future of Portal Check is working in collaboration, strengthening this joint work between different kind of actors and trying to counter disinformation the more we can with this kind of strategy.
I want to thank you, both of you, for this very interesting discussion. And I wish you all the best in your work. And I hope that you continue to debunk a lot of this fake news. Yes, thank you very much, and have a very nice day.
Thank you.
Yeah.
Thank you
Bye-bye.
very much.
Yeah.
Thank you.
The next video. Yes.
So, yes, the next video comes from Iraq. It is also part of the UNESCO program, which is the thematic addressing disinfodemic on the COVID-19.
Mm-hmm.
So in Iraq alone, 18 journalists passed away since the beginning of this pandemic.
Wow.
So the goal of this project was initially to train 1,000 journalists, which they have already surpassed this number.
Mm-hmm.
So the goal is to train journalists so they can better protect themselves. So let's have the video from UNESCO partners in Iraq.
Within the context of the coronavirus facts addressing this pandemic on COVID-19, for Iraq, this project, which is funded by the EU and implemented by UNESCO, starting early May 2020. And this time we start preparing and discussions meeting with the Iraqi partners, the Ministry of the Health and the Communication and Media Commission. First, we have assigned MOU with Iraqi government represented by the Communication and Media Commission to host the FCT, fact-checking tools. Now we trained more than 1,040 journalists, and we trained in the same time special trainers, 20 trainers, to train other journalists voluntarily as we agreed with them to do this job for the benefits of the journalist community, to protect them, to teach them how to deal with the pandemic risks and the threats in the field while they do their job. I will shed light on the establishing special news agency directed by 20 female journalists. This news agency established last year in October after the training of the female journalists in this project. And now they are working in two sides. First, to help the female journalists and how to face the threats and risk of pandemic. And at the same time, they are working as a web news, provide the information, not just for the pandemic and COVID-19, it is also for general news and general issues. In the same time, we train the IMN, Iraqi Media Network staff, which is the general broadcasting services in the country, and we train the staff of CMC, which is the Media and Communication Committee. Part of the projects within the outputs of the project to let them know what is the risk of the pandemic. So in the same package of the media production content, we have a testimony from journalists who infected with the pandemic. Unfortunately, we have more than 62 journalists infected with the pandemic. Sadly, we lost more than 17th or 18th journalists dead in this virus. So it was a message of this project to the journalists, to the public, to the community, and how to deal with these threats and risks of this pandemic and the challenges of the field work for the journalists themselves. We hope in this project to create an educated journalist community on the pandemic and viruses and diseases and how to deal with these difficulties and challenges and these risks threats in the field. Thank you.
Thank you very much, Dia Subhe from Iraq, for sharing with us this difficult and challenging work you are doing there. It's very unfortunate, very, very unfortunate, but that's something we see more and more, that many media organizations are taking security measures, hiring bodyguards, and also because they are under constant threat. They are facing a lot of problems. So thank you for the good work and continue the work there. Then we go to the final presentation of the OIF's experience, the OIF experience of the COVID response in the fact-checking area by Bernard Levant of OIF, who will highlight some Francophone responses OIF has supported during the pandemic by a mechanism put in place last year. They will share some lessons from a study about fact-checking initiatives in the Francophone space, share short reflections about this study and the main objectives OIF will pursue in its activities related with fight against disinformation and capacity building of Francophone fact-checking initiatives.
Bonjour à toutes et à tous. Je voudrais remercier l'UNESCO pour son invitation et je suis ravi de contribuer.
Thank you everyone for UNESCO, and I'm glad that I can take part in this meeting. In my quality of a representative of the OIF, I shall remind you that our organization has 88 members, associated or observers in the 5 continents. And we try to promote the French language, of course, but also to promote democracy and the rule of law. This is why we support the media and we try to support the freedom of press, especially during electoral campaigns. Fact-checking is extremely important. We saw it during the pandemic. In March 2020, we launched a platform for the Francophone space in order to help all organizations involved to fight against fake news regarding the pandemic. We now have over 1,000 members. We've organized webinars on this matter, and we have a mechanism to check information in the Francophone area. We have countries from Africa, Europe and the Caribbean, and we've helped them to promote their work and to intensify their work of fact-checking. We have several initiatives. First, anti-fake news. This is a voluntary initiative that gathers different journalists, bloggers, but also translators. This is an initiative that has its own web page, and it spreads information in local languages. Second initiative, Journalistes Solidaires. It's also a voluntary initiative that was created during the crisis, and it gathers developers and journalists. In a few months only, they managed to set up a platform in order to fight against disinformation by implementing several initiatives and platforms. This shows 4 challenges that are important for our organization. First, there is a language challenge for all Francophone organizations to work together. And then it's also a local challenge because we have to help vulnerable people who are sometimes illiterate. We also try to have greater proximity when it comes to fact-checking, but also to analyze the context of disinformation. Then there is a structure and sustainability in order to make sure that these initiatives last after the crisis. Fourth challenge, we need to work together between the different actors in several fields, with journalists, but also with technical staffs and managers as well. In a report that was published by the OIF, we see that several initiatives has been sensed in the Observatory for the fight against disinformation. This confirms the expectations that come from the OIF, but also this underscores all the factors and the needs for more initiatives to be set up. All of these initiatives can work thanks to all the citizens and all the talents that we have as part of these initiatives. In the months to come, we'll try to reinforce and to build capacity through initiatives. We see that these initiatives have proven to be important and useful for all communities and populations during the pandemic. Our action will try to put in place mechanisms as well to fight against the pandemic and disinformation, and we'll try to develop research on disinformation in order to do so and to fight against fake news, which have been exacerbated during the pandemic. We need to support all actors who fight against these fake news and who fight for fact-checking. This has been also repeated during. This will be repeated during the International Day of the Freedom of Press. We want to commend all of the actors and all the task force that has been set up as well. I would like to wish you a fruitful conference, but also a great International Day for the Freedom of Press. Thank you very much, Bertrand Levent. I believe we all agree with what you said and the need to fight against fake news. I would like to thank the OIF as well for the work it carries out in this field.
So now let me switch to English. This was, in a nutshell, the different emergency measures implemented all around the world, from Latin America to the Caribbean and the Sub-Saharan Africa. All of them are supported by the European Union. We hope that these initiatives have in some ways inspired you. Thank you for being with us and on this year World Press Freedom Day.
A lot of people contributed to this 1 hour session. First of all, our partners who made beautiful videos, and we are available to reply on our questions. Thank you very much. Also want to thank you, Andrea Cairola of the Freedom of Expression and Safety of Journalists section of UNESCO, and Leon Williams of Free Press Unlimited, who initiated these sessions. And thanks to Caroline Hammerberg from UNESCO, and of course, our own Leon van den Broekert from Free Press Unlimited, for putting together all the details for this conference to take place. Thanks EU, thanks UNESCO, and thanks the government of Namibia for hosting this event. Thank you very much.
Please have a look on the UNESCO page to see the program of those conferences. In the meantime, please stay safe, because we all know that COVID-19 is real. All the best.